Senator Wyden.
Thank you, Mr. Chairman. Madam Secretary, at community meetings at home, Oregonians tell me to do everything I can to stop what they see as ridiculous, petty bickering here in Washington and help get results by working cooperatively. So in that spirit, as I told you, I'm going to pass this morning on the blame game. And for a few minutes, for this moment even, let's just say Democrats and Republicans are going to try to find some real common ground on this. Now, the Affordable Care Act we discussed today focuses on expanding coverage, financial help to those who can't afford insurance, and more private sector choices for patients. Before the Affordable Care Act, the last health care reform was the expansion of Medicare to provide prescription drugs to America's senior citizens. Known as Medicare Part D, it was enacted during the Bush administration. And like the Affordable Care Act, it zeroed in on the same concerns: expanding coverage, financial assistance to the needy, increased marketplace choices. Medicare Part D has been a huge success, and anyone who doubts it ought to think about the terrific hearing Chairman Nelson held in the Aging Committee just a few weeks ago, where Democrats and Republicans all made this point. The Medicare prescription drug program has been a godsend to millions of seniors by offering life-saving medicine, and it has cost 30% less than the Congressional Budget Office had predicted. But the Medicare prescription drug program, as you know, didn't start out so hot. The reality of the first few months of that prescription drug program was pretty much bedlam. So I went back and looked at the newspapers from that time, and I'll just describe a few of the headlines. Quote, "Glitches in drug plan upset seniors," read one paper. "Medicare drug program is a wasteful disaster," read another. "Medicare blunders become a monster," read a third. These headlines about the Medicare prescription drug program, the Democrats and Republicans now together say are a success. The headlines of the Medicare prescription drug program are exactly the type of headlines that have been written about the Affordable Care Act in recent weeks. Now, fortunately, the Medicare prescription drug program got fixed, and it got the chance to get off the ground. If it had been repealed, millions of seniors today wouldn't have access to life-saving drugs, and not a single member of this committee wants that. So my question to you is, what, in your view, Madam Secretary, could Democratic and Republican senators here on the Finance Committee do to make the latest health reforms a success the way the Medicare prescription drug program has been?
Well, Senator, I think that it is always welcome to have elected officials in their home states give information to constituents about what the law says, what their options are, what their benefits could be, what choices they have, and how to access the process. That would be enormously helpful, particularly to constituents who may not be web savvy, who may not know about the law, who may not be following this, but whose families need the benefits. I do feel that there is no excuse for what has been a miserable 5 weeks. I am committed to the fix of the website. On the other hand, I do know that people are using it every day, and the experience is getting better every day. So again, encouraging folks to use the website, use the call center, enroll in person at a health center, find a navigator in the neighborhood is also enormously helpful. And I think we would love to work with the committee on the issues that look down the road, not just at the marketplace that we're talking about, but really the impact of having the opportunity to look at delivery system changes. I know the committee has just come up with a bipartisan proposal around the SGR, a huge issue for Medicare seniors, but looking at those kinds of frameworks that actually encourage higher value, lower cost care as we move forward with more Americans insured, I think is one effort that should have a lot of bipartisan support. The SGR framework did, and I would be encouraged to, as you know, the Affordable Care Act has a lot of features in it that deal with delivery system changes, how we get a better value for the medical dollars we're spending, how people, how access to preventive care could actually change health profile for millions of Americans. So those kinds of opportunities, which are finally here, thanks to the Affordable Care Act,
Thank you,
are all ones
Thank you,
we'd
Senator,
love to
very much.